Welcome, everybody. It's our local guest segments, and we today have Three Rivers Public Health joining us, and we have the leader of the group, Terra Uhing. Thank you for coming in today.
Thank you for having me. I'm excited to be here.
So we, are getting used to our new facility, and it's great to have individuals like you come in to be able to see and be a part of this.
It's a beautiful space, and it's so nice. It's inviting, and it's just neat to see the growth that you guys are experiencing and the difference that you're able to make.
Well, thank you very much. And again, it's all about the partnerships with our community. And it's whether it's here or Saunders County or Dodge County, wherever our impact is, just like you, it's the Tri-County area that we try to take care of.
Yes. So Dodge, Washington, and Saunders, we too have a newer office here in Washington County. We also have an office in Saunders County, and then our main headquarters is in Dodge County and Fremont. And so, it's hard to be in three places at one time, but I am thrilled to say, for the first time in our history, we do have an office space or try to be at a location in the three counties that we serve.
Exactly, and that is being able to not talk about, just talk about. It's like, hey, we cover these areas, but have that presence there.
Yes, and we are here.
Right, and that's a big deal. Be able to be face to face, and that's one of those things when we are in our counties that we work with. It's the individual love to be able to say, yes, I can actually come and ask you a question directly.
Yep. And it's really, really hard to say, yes, I'm the expert, I know what's happening there. We're in Dodge County 5 days a week in Fremont. We're here in Washington County 4 days a week, here in Blair. And then we are in Saunders County 1 day a week, just outside of Wahoo at the Lake Wanahoo Clinic. And, it's really, really hard because all three of the counties that we serve are all very, very different.
They are.
That's why the collaboration, the partnerships, knowing who to call, knowing who to be able to tap into, or even having the relationship to say, hey, we need to have a conversation about that is really important. Having a space, having a face in our counties, and in our communities is important for everyone. It doesn't mean we're the experts, but it means that hopefully we have relationships in place to be able to reach out to those that are.
Well, I see it as a benefit that when, let's say, we'll go back to mandates and stuff like that, you have the ability to try to interpret how that really impacts and affects because you are a part of it in the community.
Yes, and I think, even if I do stop here and I pause and I think a little bit about COVID, so different in each of the towns, municipalities, cities, that we serve, but being able to say, no, hey, I'm here, I understand it, that really, that helped a lot.
Yeah.
That actually is how we ended up with a Washington County or a Blair office. We actually were starting on trying to find space for Washington County right before COVID, and we had just started, our Saunders County location. And I said, we really want an office in Blair, somewhere in Blair. Well, then, of course, COVID happened, so that got postponed for a little bit. But that really reinforced the need for being there, boots on the ground, having some kind of an understanding, and then being able to partner with those, that might have questions. They can come in and actually talk to somebody if they have to and not pick up a phone or see you through Zoom, but be able to have those conversations and ask those questions because that was what we really found is what built trust.
Right, and that is key because... Yeah, that's when it comes to some of these things, and everybody's like, you go to the, Facebook, and you have all of the opinions out there, or the I heard this, or suppose it's on that. It's nice to actually be able to say, no, this is the reality. This is what was really said, and be able to be there to communicate that.
Well, and I remember there'd be sometimes, where there'd be a news conference or, we'd say something or, there'd be something and I'm like, no, that wasn't the intention. That's not what they said. And, so I even saw it, sometimes not necessarily just with myself, but, with being part of other things too. And there's so much that can be misconstrued. So again, being in your communities, having a face that they can, hopefully call, or an organization, or know that there's people here, that was really important to me. So I'm excited.
Yeah.
We have one in each of the 3 counties now. It's 2026 now, and so now I'm like, we're taking it to that next level. I want to get us a little bit busier. I want to make sure that we're serving people, that if there's questions, we're able to answer those, whether that be on well water testing kits, radon kits, colon cancer screening kits, or even more importantly, immunizations, and keeping our communities as healthy and safe as we can. I'm sure you've seen right now there's a measles outbreak here in Nebraska. So again, what can we do to have our healthcare professionals talk to parents if need be, or talk to kiddos, as mom and dad are bringing them in, but again, doing our part to keep our communities as healthy and safe as we can.
Right, and again, showing that you grew up here and you're actually a part of the community. You live in Dodge County.
Well,
At least I've seen you like at all the county fairs.
yes, I live just outside of Dodge County.
Okay.
So I'm actually 2 miles from Washington County, 1 mile from Dodge County.
Oh, okay.
But I technically
everybody around here knows exactly where that is.
Yes, right? It's up there. But I will tell you that I have worked in Dodge County, or have been part of, 3 Rivers, I guess, so the 3 counties, for almost 15 years.
Yeah.
Lived over in this part of Nebraska since 1997, 1998. So been, very, very familiar. So from actually where I live, you're going to laugh. Fremont is 25 miles and Blair is 25 miles.
Yeah.
Just, right there. But which I think is even a little bit more important. So I live on a farm. My husband and I, we farm. We have a row crop operation and then a cow-calf operation.
Sure.
So it gives me a little bit of a unique perspective, I guess, if you will. But, I have come to Blair for many, many years for selling commodities, also going to Fremont, with the grain elevators and things there. So have been regularly part of, I was married in Blair, so it's yeah.
Well, but then also you have that relationship with that community.
Yep.
The rural and the farming ag community, that is like 90% of what drives our 3 counties.
It is, and it's Fremont's our biggest town, or our biggest city, and we're really and I go back to say this, we're really fortunate because they're all 3 so different, but we are largely rural. We're not urban, but we lay in our place just outside of the largest metropolitan area in Nebraska. But it's a different way. It's a different thing. And, if you want to reach the farmers, do you know where you go? You go to the gas station where they drink coffee. You want to find out what's happening, and you walk into a gas station or a coffee shop and they don't know you. They're going to know who you are pretty quick.
Yeah,
So it's really unique. I love what I do. I've done it a long time, but I will also be honest with you, it's tiring. What we do is science-based, right? And science is ever-changing. And I am all for differing of opinions and beliefs, because I think that's what, makes everything great. But a lot of people want to share their opinions, which is fantastic, but don't get after somebody else because their opinion is different than you.
Right.
So I think what we need more, as we go into 2026, is to make sure that where we're getting our information that our information is factual, that it is not misinformation, but just really checking that. And then, sharing and just listening to other points of view doesn't mean you have to change, but just to better understand,
I think that's also a big part of it is the mental health of the individuals being able to feel they can express themselves freely without having stress. And it doesn't matter what, because you have multiple sides of a lot of things. And, if we can actually just have a conversation with it without it getting to name calling. And things like that.
And to share information, and to get different perspectives. I think sometimes people that believe or think differently than I do, I can always learn something and take something away. But it's other people keeping that same frame of mind.
Listen to one another.
And then be nice,
Yeah.
be kind,
Yeah.
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 So I would say for 2026, when I think of Three Rivers Public Health Department and the three counties that we serve, Dodge, Washington, and Saunders, some of our core services, and we have so many different services that if people have, specific questions, they can call us about, anything that we do. But, we do a lot with reproductive health. So if there is a woman that needs a well woman exam, or needs to take a pregnancy test, or needs to be tested for something of a reproductive health nature, they can call us. Nobody is turned away because of their inability to pay.
Right.
So I would say that call, and our phone number is 402-727-5396, and that is the number that you call for any of our three locations.
Yeah.
The other thing that I think is newer for us too, we're also doing HIV testing. That goes along with STIs testing as well. Again, trying to protect, give information, and help people be as healthy as they can.
Well, every generation you have to re-educate.
Yes, and sometimes there's not education available to some, and we need to do our part to make sure folks are educated.
Yeah.
We also offer a wide variety of immunizations. We are a vaccine for children provider. Vaccine for Children is otherwise known as VFC. That means that if you have a kiddo that's under the age of 18 and they don't have insurance or they have Medicaid, and then there's a couple of other program requirements in there, they can potentially come into any of our three offices and receive vaccines, and also if they're underinsured. But they have to call our office because we have a limited supply.
Right.
There are times it's feast or famine. We have so many immunizations coming in, and there's times where it's slower. But especially, here in Blair, VFC, vaccines for children, if we can help immunize, folks that are so inclined and they meet the requirements, we want them to come in. We also have a small or a limited number of private vaccines too. So again, call us to learn more. We also this year are going to be really focusing on some health prevention things, obesity, high blood pressure, diabetes. We have a brand new active aging clinic. So if there's somebody that's over the age of 60 and they want to do some, health coaching around med management, okay, do I have a pill box? Am I eating healthy? Am I exercising enough? Are my numbers where they should? They can call, again, 402-727-5396. We will be out in the community doing these active aging clinics, but even more importantly, if one of our community locations doesn't work, they can come into our office too, and we can meet folks there.
And then not only you have those, but you also have resources of others. If it doesn't fit within your realm, then you are able to
Connect people. Connect people to services. And again, do they have a medical home? Do they have so it's all about really trying to help people, again, meet them where they are and keep them as healthy and as safe as they can, and ultimately to help our community be as healthy as we can.
Yeah. And so again, getting those resources, make sure everybody knows that they're available.
Yep.
And again, that is another part of our community or the surrounding area that we have, is that there's a lot of people that, they don't want to ask for help.
No. And they think, when they do get ready to ask for help, they think it's too late, or, they might have a wide array of problems. And we just want to know we are here. We're a health department. We have a lot of stuff we have to do according to state statute, lots of things behind the scenes that we're doing every single day to keep communities healthy and safe. But our next thing is really being a connector and a convener and making sure that there's access for those that need it. For instance, kids are going back to school. Some went yesterday, some are going today, some went Monday. But we are seeing a huge uptick in the number of positive flu.
Yeah, and those numbers are really crazy this year.
They're high, and I don't think we've seen anything yet. I think we're going to see here in 7 to 10 days.
It's just going to escalate.
Yes. So this is also a good reminder. If you're sick, we want you to stay home. If your kiddos are sick, please stay home. Well, so I think I've taken half a dozen calls this week already on just illness. I would tell you, and COVID, RSV, flu, upper respiratory, you name it. if you were sick, please stay home until you were fever-free for 24 hours, and that is not using any fever-reducing medication. So that's Advil, Tylenol, ibuprofen, acetaminophen, generic and name brand there, because that helps us to contain spread. And you want to generally be feeling better too.
Right.
Before you go back out. So I think I think it'll be interesting here to see in the next couple weeks what our flu numbers are doing. I know that I saw from just over the weekend a lot of influenza A that has come in. The other thing that I want to remind people, it is not too late to get a flu shot. If you have not gotten a flu shot and you're planning on doing some traveling, I would recommend definitely. And if you're unsure, I want people to talk to their doctors, to their medical providers,
Right.
To their trusted physician, or just it could be a nurse practitioner or PA too, to get advice from them. But again, an illness for you and I, people might think, well, flu's no big deal, it's just a cold. It can be deadly to somebody over there with an underlying health condition. I've seen even just nationally, there's been a number of kids that have unfortunately passed away this year because of complications from flu.
Right.
So just doing our part to keep everybody safe.
Well, and that's we learned from a few years ago. It wasn't necessarily COVID that did it, but it was the contributing factors or what it affected everything else.
Yeah.
Sometimes was a lot of
Well, so you'll have somebody that maybe just had a heart transplant. You'll have somebody that's going through cancer treatment.
Yeah.
You'll have somebody that just had a brand new baby who can't be vaccinated.
Right.
Those are underlying, you know what I mean? And that's our very most, yep.
So.
And then also our older folks that are in our long-term care facilities, they're our very most vulnerable.
Yes.
So doing whatever we can and knowing that, it could potentially make somebody else sick. Now, does that mean you don't go out and do anything? No. But if you're sick, you stay home. And sickness could be, you're running a fever, you're hot to touch, you stay home.
Yeah. And
So
if kids are sick, then don't send them to school because A, they're miserable. B, they're not going to learn much anyway.
No.
And C, don't spread the stuff.
Yeah. So I think it will be interesting here just to look to see what our data looks like. It started right before Christmas. Our increases maybe a week and a half before Christmas. We have some wastewater data too that I get every week, and you can kind of see it climbing. But I had somebody come into my office. They had a bunch of lab results the other day, and they're like, "Tara, I'm like, welcome to right after, it's not going to be a lot of fun this flu season this year.
Yeah.
So
all right. So
yes.
again, don't hesitate to ask and talk to if you have any questions. Three Rivers Public Health is here to be able to, if you have questions or if you want to see different perspectives on how that all comes together,
call us.
Yeah, pick up the phone.
Yep. And just as a reminder, we have an office in each of the three counties. So we are located at 2400 North Lincoln Avenue in Fremont. We are open there Monday through Friday, except for major holidays. We have an office in Blair, 1762 Washington. We're in the Vinton Corner building. So, and I'd like to say on the garden level. The garden level.
You enter next to the mural of the car.
Yes, and I think that's the west.
That's the west side.
The west side. So I like to tell people we kind of have a different entrance, so then you're not having to park on Washington. You can park off.
A parking lot.
Yes, and so that's really nice. And we are there Tuesdays through Fridays, and then we also are in Wahoo, or right outside of Wahoo, at the Lake Wanahoo Clinic. So just on the outside, the northern part of Wahoo, just outside the city limits there.
By the airport.
Right next to the airport and by Baumgars.
Yes.
And that's in a very important store in our house.
Yes.
So we are there every Monday, and of course, if it's a holiday, but we are here to serve the three counties, that we serve. And obviously, when we're in those locations, we're running clinic sites, those types of things. But you call one number for all three locations, and that's 402-727-5396.
You can always go to their website, threeriverspublichealth.org.
Yes.
Or follow, obviously, on Facebook, Instagram, and all that stuff, because as you have information to send out, that's the first place you send it.
Yep, and we try to post things on there pretty regularly, and so our social media presence, we try to be present there too.
Yeah.
So
again, well, thank you for coming in.
Thank you.
Great conversation again. Just don't hesitate to ask because we are in this together. We are friends. We are neighbors. We're families, and being able to try to do the best for our communities and keep everybody healthy and have a nice path forward.
yeah, and together, I truly believe we can do more together. So thank you for having me.
Yeah, thank you very much, and we look forward to you guys coming in every other week right here.
Yes, thank you.